Oops, hang on. Oh, wait, what? Veg Chick sent me this. CPR News, there are now 8 presumptive positive coronavirus cases in Colorado. Breaking news from CPR News. There are now 8 presumptive coronavirus cases in Colorado. The number went from 2 to 8. I didn't even know this. Thanks for passing that along. I'll check out that article in a second. Veg Chick. Here it is. Colorado. There are 3 more cases of COVID-19, the disease caused by the new coronavirus, that have been reported in Colorado. That brings the total number of cases in the state to 8. Counties. Here's the counties. Denver 2, Douglas 3, Eagle 1, El Paso 1, Summit 1. According to the, hold on, let me go back here. Hang on. Where was I? Here I was. Okay. Sorry about that. Let's see here. Trevor Bedford is a scientist at UWashington who has been doing some analyses of the Washington cases, of the Washington virus, of a certain strain of the virus in Washington. And he posted from, he's looking at one cluster in Washington, and he says, we estimate the prevalence of active infections from this one cluster is 620, but it could be between 120 and 1,600. And he says from this cluster alone, which his folks consider is 620 now, he says that it could be responsible for 1,100 by March 10th and 2,000 by March 15th. That's doubling pretty fast. So I've seen estimates that the doubling number is around like 6 days. I'm not sure, but I've seen that written. Oh, Rebecca Coy points out spring break is coming up too. Oh my gosh. It's unbelievable. It's going to get worse and worse every day. Oh. Trump has named Mark Meadows his chief of staff, just so you know. Congressman Mark Meadows named chief of staff by President Trump, replacing acting chief of staff Mick Mulvaney. Okay. Ah, I see. Yeah, Jennifer Carr sent me this on the Colorado cases. They now have 8 there. Jared Polis, the governor, if I'm pronouncing that right, Polis, at least 5 of the cases have an international travel history in Colorado. But 2 of them are unknown origin. El Paso County and one of the Denver counties are of unknown origin. Thank you for sending that, Jennifer Carr. Sean P. sent me this. Brad Edwards says, top Chicago public school source told me the paraprofessional school aide who tested positive for COVID-19, she is from Chicago, had intimate hands-on contact with numerous special needs medically fragile students over the past several days. Described situation as all hands on deck. This is somebody who worked at a classroom as a special ed classroom aide and now has the virus. This was sent to me by Tech TK420. Emma Galasso says, the possible coronavirus patient in Charleston County, I believe that person tested positive. When it says possible patient, I believe they are presumptive positive. MUSC Health, which is Charleston's hospital of choice, a hospital confirms that this person who has tested positive is one of their team members. She is currently not working and hasn't worked since returning from Europe. Oh, hold on a second here. Hang on. Oh, hang on. Our viewer told me Hawaii's having a press conference. eMorningstar. What is this? Hawaii press conference with the governor about response to Grand Princess Cruise members. Hold on.
When do you think you can do broader community testing? I mean, it's the reason Seattle is in this predicament is because it didn't do widespread testing quick enough?
Certainly, I do think that part of that is driven by the ability to test and the number of cases that we may or may not see. So we are monitoring that. We are looking at potential spread. We have informed all of our healthcare professionals about what symptoms to look for and what would be the casework that they would be looking at that would lead us to test for the COVID-19 virus. So we do believe that our physicians across the state are well positioned to identify potential cases and identify those for testing. You know, we would be looking at a broader sentinel testing plan, and right, Bruce, you may.
Elaborate a little more. We are planning a sentinel survey of individuals here who have respiratory illness to see if some of that might be unrecognized COVID-19. We were planning that to begin possibly as early as next week. Frankly, with the situation here and the uncertain testing requirements, we may have to put that off a bit. But our plan was to go forward with that program. We were looking to potentially sample as many as 200 individuals and run those samples here in Hawaii. So we would hopefully have some results within a couple of weeks. Obviously, this is an issue all over the country where we're looking to see whether there is virus circulating within the community. Let me emphasize that we have no evidence that there is virus circulating in the community. This first case that we have now was clearly exposed on that first voyage and became ill because of that exposure. And that was consistent with all the previous cases we've had here. So we have no evidence that anyone has been exposed and is ill from having come into contact with someone here in Hawaii.
How many tests have you done? So you have the capacity to test up to 250 a week. How many have you done?
We've now done a total of 8 PUIs since we could do the analysis on Friday. We can ramp up that, of course, and our capacity is at least 250 per week, and if we need to, we can double that, which should give us an opportunity to look at individuals who have serious illness. To do the surveys we discussed will require, of course, a lot more sampling and testing. So we're working that into what we're doing in case investigations. Obviously, the case investigations are going to come first. They're a higher priority for us because we want to be sure that anyone who's ill will be tested quickly, and that way we can follow up on contacts and so forth.
All right, so I just wanted to check in on that press conference. You know, Hawaii, they've had, you know, the Grand Princess cruise ship, which is the one that had 21 people tested positive in the last day. That's off the coast of California. That cruise ship recently went to Hawaii. So, you know, and then they also had a couple of the Japanese tourists who tested positive in Japan who had been to Hawaii. I don't believe Hawaii has any cases yet, though. I don't think they do. Do they? I don't know. I don't recall any Hawaii cases. Anyways, let me actually show you. Here's a map from the New York Times. They don't have Hawaii on the map. But anyways, I don't know that there's one in Hawaii. You can see the biggest circle is in Washington, but there's a bunch in New York State, Westchester County, all around the Bay Area. There's a lot too, but a lot of places haven't started testing. All right, give me a shout if you have comments, questions at Lookner on Twitter. Hey, let me say a quick thank you to our moderators. They're amazing. They are always there, keeping the chat troll-free. Thank you, moderators. Danny James is there. Mishi Melody. Luke M. Tech. Christopher Lund. So thank you to all of our moderators. Contao Creek. Also, our Periscope moderators, JKD. Oh, BNO reported a case in Hawaii? Really? When? Hold on. I didn't know that. Didn't know. Oh, there you go. maybe they said it at the beginning of the press conference. We weren't there for the beginning. So what I can do is I can go back when the Hawaii press conference ends. I can go back. Also, I'll just do this, and let me just look up Hawaii News Now. Oh, Hawaii resident who traveled on cruise ship. A Hawaii resident who traveled on the Grand Princess is the first case. The resident traveled on the Grand Princess in early February and returned home to the islands. The patient contracted the virus on the Grand Princess. That's somebody else. That same vessel made 4 ports of call in Hawaii on the current voyage. Unbelievable. Oh, Eddie Smith, I think, is moderating too. Thank you, Eddie Smith. Thank you, Generic Matter, who's moderating for the heads up about the Hawaii case. Thank you, Generic Matter, Sharon Craig, Linda Belk, JKD, Misha, Texas Legends, Brian, and all of our moderators in our Periscope chat. Fire Captain. Brenda G says, so glad I canceled my cruise for May. Thank you also to our Facebook moderators and our Twitch moderators. In Twitch, we have moderators like Daily Disclosure, Matthew Johnson, Idaho Star, Keisha Umaroth, Callie, Smoke, Love Pugs, and others. And in Facebook, we have Shay Durner, Courtney Lane, and Denise Fredrickson and the rest. Thank you, moderators, very much. Oh, Eddie's on the road today. Thank you, Eddie. Thank you also, Eddie, Raymond Willis, Eddie, CJC, Chandra, Farva, Falling Angel, KONYX. And NFG Vets and Rudy Mills and Sonic. And I don't know if I mentioned Ziphelidor Elvix. Thank you. And Carp DM. And also Beverly Moeller. Thank you. Okay. Oh, also, one more. I missed it. Lisa Kober. Thank you, Lisa. Who mentions the, thank you, Lisa, who mentions the Connecticut case. I don't think we talked about the Connecticut case yet. I should probably mention it. It has been just non-stop news on this today. Non-stop. All day. Yeah, here it is. First case of coronavirus in Connecticut reported in Danbury. Oh, it's a resident of Westchester County. Wait, what? The person is infected as an employee from Danbury Hospital and Norwalk Hospital and a New York resident. The person lives in Westchester County and is currently under self-quarantine. Oh. So it's not a Connecticut resident, it's a Connecticut worker. The hospital employee came into contact with a limited number of patients. Ugh. She has not returned to Connecticut since she was first tested. Connecticut has tested 42 people so far. Not that many. A lot of states have tested around that many. Oh, let's see here.